Good morning, guys. We are here with Steve and Janet, and we're going to talk a little bit about the Immune Clinic. I know we talked about it. Gosh, it's already been several months, right, Steve?
Yeah, I think so. Yeah.
So we're doing an update on the Immune Clinic here at Ersfeld Pharmacy. When we developed the Immune Clinic, we were like right in the middle of the pandemic, and we were trying to meet people where they were at and get them some resources. And as it's unfolded, we found a lot of ways that we can help people. And so we're going to talk about that today. First and foremost, Steve, I'm going to just have you talk to us about immune health in general.
Okay, so we think about immune health and we think about what's going on with the pandemic and COVID. Just some things that kind of come to mind right out of the chute. Who are the people that are suffering the most with COVID? And we know that historically, our older people, are people that are obese, and are people with multiple comorbidities or disease states. Those seem to be the people that are getting hit the hardest. We can't really affect age. We know that, right? Dang it. But obesity and comorbidities are things that we can work on, definitely, for sure. So also, when we think about other patients, low vitamin D status seems to be a concern with those getting hit the hardest. Also, omega-3 fatty acid status is another marker that can be. And I know there's other ones out there too. So these are all things that we look at our nutrition and diets and lifestyle. All those things are kind of factors that fall into that. So our immune system, very complex, needs care. We've got some ideas and solutions to help with that care of that.
All righty. And then you have the patients that have been affected by COVID and they have this ongoing effects. Janet, can you speak to, some things that we can address if they're just having a hard time getting back to their normal self, whether it be energy or other symptoms?
Yeah, I think the best resources you have is what you can do for yourself. Like age, we can't change, but we know dietary wise, supplement wise, things that are beneficial. It's really a challenge you find in patients of getting even the normal recommendations for daily allowances that we are supposed to have. And I think when COVID and what has taught all of us that we can really focus on things that we actually have research now that is actually shown to be beneficial and improve some of these long-term effects we see. I tell patients it's kind of like, if you've ever had shingles, on the long-term effect of shingles, and all of us that went through the polio era, what can happen with polio. And now it's really frightening when you see all the long-term effects that they're showing up with the post-COVID morbidity issues that we're finding. So the things that you can do right now to help you if you're experiencing any of these episodes in your health, and get some things to help you go. And a lot of it's some of the behavior you can easily do, and we actually have resources to reinforce that.
All righty. What about the term long hauler, Steve?
Yeah, right. Okay, we got a lot of terms that have cropped up in the last couple of years that we were never familiar with. Social distancing, long haulers, cytokine storm, all these sort of things that are unique to COVID. So long haulers basically looking at patients that have had COVID and they seem to have lingering after effects of it. Things don't start to turn around for them. There are some, when you look and you do some searching, there's not a whole lot that is available conventionally that can help those. But if we just look at COVID in general and think about, what's going on when we get COVID, we know it's inflammation that's kind of run away. And that's kind of what's going on. And is this inflammation ongoing? There's things that we can do to test. I mean, I'm a huge fan of everybody should know where they are with their CRP. I don't know if you feel the same way, Janet, but I think it's probably an underutilized test in some respect, because that just gives us a baseline. Do we have inflammation? Are we inflamed? And if we are, boy, you know, addressing that and trying to get that under control, that can pose some big improvements in how a person feels. So yeah, long haulers, you know, we have some things that we think that might be beneficial in that area as well. So
For sure. And then that goes back to Janet's discussion on daily nutritional. I mean, there's things that we can put into our body that are going to make us feel worse. So if you're recovering, yeah, it's important to go to the refrigerator and pick a pear or an apple over a bag of chips or those types of things, right?
Easy thing to remember is, you know, eat your colors
Yeah.
and not Dorito color.
Rainbow.
Yeah.
So that kind of in a nutshell is, you know, we've got a lot of tools in the toolbox for whether it be preventative COVID, recovery COVID patients. And then on our next video, we're going to talk more about other ways we can help patients, non-COVID related, but more like great lifestyle choices. So.
You know, and I think, you know, just that important phone call and making that initial assessment, so people don't sit there and worry about some of their symptoms if the reality of what they feel their health is doing, just to reinforce to them, to get them into something, to give them some positive feedback, because they have to be responsible for themselves.
So this is pretty easy. On our website, www.ersfeldpharmacy.com, there is a tab that says Immune Clinic. And you can go on there and schedule an appointment. And it also goes through what you get with the Immune Clinic, but you get 2 visits. The first with Janet, and she does some assessments that are sent out to you prior to signing up, or well, when you sign up, but prior to that first Zoom session. And then your second meeting is going to be with Steve Ersfeld. And then the 2 of them together kind of put together a plan, and that's personalized to you. So it's a great value. In addition to that, you get a 20% off of some nutritional or a nutritional purchase. So 3, and then a follow-up call. So really you get 4 pieces of 4 resources for $160, which I think is a great value.
And I think just you taking the time to do the personal assessments really focuses for you things that you can't put into words to relate to your provider. And this literally gives you a map and makes you think about things that you're experiencing, which helps us then to understand what else is going on with your immune system status.
So what's your saying always, Steve?
be vigilant about your health.
All righty. Thanks for tuning in.
Thanks.
Have a good day.